Hey, thanks for checking out the videos. Dr. Matt Phinney, chiropractor right here in Grand Rapids, Michigan with Chiropractic Doctors. Common thing I'm seeing nowadays is people will get an MRI done, they've got a back injury. The ordering doctor, whoever ordered the MRI, I'll ask them, did they go over it with you? And they will say, no. Didn't explain anything to me. So docs should always be going over the MRI results with their patients. But a lot of times there's big words on there that can seem really scary. So in this video, I'm going to break some of those down for you just so you have a better understanding as to what's going on. These are not terms that I've made up on my own. These actually come from the North American Society for Radiographic Nomenclature, based on two big studies, the FARDON study 2001, and then also FARDON study 2014. So when we look at a disc, you look at a normal disc, we break it down into what we call quadrants. So there's four big quadrants. This is looking at a disc from the top view angle. And really there's 25%, 25%, 25%, 25%. That's what we're looking at. Symmetrical disc bulge. So if you see on your MRI report, it says disc bulge. What that means is that there's a portion of the disc going out beyond the end plate of the bone, which is greater than, 50%. Asymmetric disc bulge, 50% is greater than 50%, but it's going more to one side than the other. It could be left side, right side. So typically an asymmetric disc bulge to the right, it's going to put pressure on the nerve root in the right, and that can cause shooting pain down the leg, or also cause shooting pain down the arm. Big thing, bigger is better. So they're easier to treat. They typically respond better, quicker, and they're not as likely to spontaneously regress. Focal disc herniation. So that means less than 25% of the disc is going out above or beyond the end plate material. That's a focal disc herniation. A broad-based herniation, greater than 25%, but is less than 50%. Over 50% is a bulge, so 25 to 50, we're calling that a broad-based disc herniation. Protrusion and extrusion, these are both forms of herniation. So protrusion, you look at the lower left, think of a pro football player. Protrusion, they've got that wide stance, means the base is wider than the top. And extrusion means the top of the herniation is wider than the bottom. And those can go up and down the canal, and they can cause other types of problems. They can be more difficult to treat. A complete sequestration is when a part of the material, disc material, is actually entered or basically cut off, so they're not connected anymore. And that also can be more difficult to treat. Hope I answered some of your questions. If you guys have any other questions, please don't hesitate to hit me up. But those are kind of the quick version guide to reading an MRI report. Hope everyone has a great day and look forward to hearing from you soon.